One of the great things about hosting a show like Midday Maryland is the awareness that we can bring to the public on a variety of topics. Dr. Lawson Grumbine is with GBMC Health Partners, and he's here to tell us about thyroid eye disease. Thank you so much for being with us.
Thanks for having me.
So what exactly is thyroid eye disease?
So this is an autoimmune condition where your body's own inflammatory system becomes activated in an abnormal way, and it happens to affect the tissues that surround the eye as well as the tissues of the thyroid gland.
So what is the relation between the eye condition and your actual thyroid?
Yeah, so it seems kind of random, but it has to do with, at the cellular level, there are little receptors on the cells in the thyroid gland as well as the eye socket that are the target of the body's immune system, and this is what causes activation of the inflammation, and it happens to be in the thyroid gland and the eye socket uniquely, so kind of like a lock and key type of mechanism.
And then what are some of the symptoms that a patient might experience when this is happening to them?
So some are non-specific just from the inflammation, and so that can be hard to figure out what's going on, and those are redness of the eyelids, puffiness around the eyes, irritation, tearing, so things that a lot of people have. But then some more specific findings are eyelid retraction, which is a situation where the eyelids become more open than normal.
Okay.
There's proptosis, which is actually bulging of the eyes out of the eye socket. There can be double vision if the muscles that surround the eye are affected, and then most worrisome, we can have loss of vision if the inflammation and swelling are bad enough that the optic nerve becomes affected.
And is this something that happens like over time as people get older, or can this happen at any time when they're younger too?
So this can happen anytime. Most commonly we see it in women or in their 40s or 50s, but certainly you can see it in pediatric patients as well as the very elderly.
Okay, and if someone is noticing this, they can come to you. There's treatments that are becoming available. You have a plethora of treatments. Tell us a little bit about that.
So this is a very frustrating condition because our classic treatments are really aimed at support and comfort, so keeping people comfortable during the initial inflammation and getting them through that period of inflammation without any vision-threatening sequelae.
Okay.
But we're very excited because there's a new medication hopefully coming available to the public this year that would be first of its kind.
Oh, wow.
And it would actually reduce the inflammation, potentially eliminate some of the changes that happen around the eye, and do it in a long-lasting manner. And so while it's not available yet, we're going to be fully ready to offer it to our patients at GBMC when it is. So we're very excited about
You've
this.
got your eye on it.
Absolutely,
There you go.
for 2020.
And with your practice, tell us about your practice just in general. I mean, just the fact that you're forward thinking, you're looking at this medication, you guys are always on the forefront of new technology, new medications to help your patients.
Absolutely. So we have a full service ophthalmology department, and we are in a convenient community setting, but certainly all of our physicians and practitioners are up to date on the latest treatments for patients.
Great. And if someone wants to get in touch with you, because they probably are watching this and see a loved one that might be experiencing these conditions that we talked about, or maybe themselves, they can do so. They should just, go to the website or make a call there. There we go. We got the address right on the screen, phone number right on the screen as well, and you've got both those locations there that they can reach out to you, correct?
Absolutely. So either on the main campus of GBMC or our newer location off of Pleasant Plains Road, off of Joppa Road.
Perfect. All right. So we are set. Every location, every condition, we can go to you. All right. Thank you so much for being here, Dr. Grumbine. We appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.